pleased that more than 250 people are here today to reflect, yes, get used to clapping, because you will clap today, because we're going to celebrate today. We're going to celebrate the progress that Rhode Island has made in achieving positive health outcomes for children and set a path to defend this progress in the face of current threats. We hope you will spread the word about the benefits of right care and what you can do to defend it on social media by using the hashtag RightCareWorks. I'd like to thank the elected officials who are here today: Lieutenant Governor Sabina Matos, U.S. Senator Jack Reed, U.S. Representative Seth Magaziner, U.S. Representative Gabe Amo, Rhode Island Representative Julie Casimiro, who's here on behalf of the Rhode Island House of Representatives, Rhode Island Senate Whip David Takoyan on behalf of the Rhode Island Senate, and then members of the Rhode Island General Assembly, including Rhode Island Senators Sharon Burke, Senator Bridget Valverde, Senator Ramos Vargas, and our awardees, Senator Alana DeMario and Senator Jacob Basilian. And from the Rhode Island House of Representatives, we have Representative Jennifer Boylan, Representative Susan Donovan, Representative Art Handy, Representative Marianne Shawcross-Smith, Representative Rebecca Kistler, and our awardees, Representative Josh Giraldo and Representative Teresa Tansey. And from our cities, today we have Mayor Maria Rivera from Central Falls and Mayor Charles Lombardi from North Providence. And I also want to thank our department directors who are here today. Department of Health Director Jerome Larkin, Office of Behavioral Healthcare, Developmental Disabilities and Hospitals Richard Leclerc, Health Source Rhode Island Director Lindsay Lang, Office of the Health Insurance Commissioner Commissioner Corey King, Department of Human Services Director Kimberly Marolo Brito, Department of Children, Youth and Families Director Ashley Deckert, Office of the Child's Advocate Caitlin Medeiros, Rhode Island Department of Education Commissioner Angelica Infante Green, and Department of Revenue Director Tom Verdi. We also want to acknowledge Secretary of State Greg Amore and General Treasurer James Diosa, who are here today. I want to thank all of you for the work you have done on health coverage and other issues that affect children's health and well-being. I also want to thank our Children's Health and Well-Being sponsors: Care New England, Blue Cross Blue Shield of Rhode Island, Delta Dental of Rhode Island, Points 32 Tufts Health Plan, United Healthcare, and Neighborhood Health Plan of Rhode Island. Thank you so much for your sponsorships. And we also like to thank our Children's Health and Wellbeing supporters and allies who you can find listed on the program agenda. And we cannot do this work without the strong partnership of our community partners who are here today, including the Economic Progress Institute, the Latino Policy Institute, the Immigrants Coalition, the Boys and Girls Club of Northern Rhode Island, Young Voices, Rhode Island Communities for Justice, the Rhode Island Association for the Education of Young Children, the Rhode Island Coalition of Children and Families, Tides Family Service of Rhode Island, and many more. And I would particularly like to thank the members of the Right from the Start campaign and the Raising Rhode Island Coalition for their partnership on advocacy on equity and issues related to the social drivers of health. And many thanks to all of you who brought donations of non-perishable food and gift cards to support the United Way's Stuff the Trunk event, which will help to feed families this Thanksgiving season. Thank you so much. I'm also very pleased and honored to work alongside some incredible board members who are here today: Olga Varsagova, Greg Perry, and Stephanie Beauty. I'd also like to thank the Rhode Island KIDSCount staff who make these events possible. And you will hear more from our Health Policy Associate, Michaela Carroll. Her work is incredible, and you will see that today. And we are are joined today by the most important people in the room, our families. Parents and caregivers are a child's first advocates. Their strength, power, and determination of a parent or a caregiver commands our attention and raises awareness of challenges to accessing important health services and how well-intentioned policies play out in your life. We all must acknowledge the power of parents to build public will and pressure for change. Without their stories and advocacy, and without the legislative champions who listen to them, we will not have the progress we are celebrating today. And Rhode Island has made progress. Despite the federal government's attacks on equity, democracy, and the country's constitutional commitment to promote the general welfare. For 60 years, the U.S. has acknowledged the need to reduce the out-of-pocket medical expenses for low-income families. And as a result, Medicaid has been an important anti-poverty program. I am sure many of you, like me, have been watching the changes coming from D.C. And you may have felt, as I did, a lot of anger, some helplessness, anxiety, and feelings of being extremely overwhelmed. Because we know how important access to Medicaid is for our babies, children, and their families. We know that right care works. We and all of those before us have worked so hard to get us to where we are today. And to see it dismantled right before our eyes is demoralizing. But I hope you do not feel those feelings for too long. Don't stay in those feelings. Because we must outwit, outlast, and outplay those who threaten the health, safety, and well-being of our children. This is truly about survival, and it's not a game. This is our moment to come together, to put aside differences, and to be innovative with our strategies, and prioritize the defense of our children and families in all of Rhode Island's progress. Now I'd like to turn our attention to our data presentation by Michaela Carroll, our Health Policy Associate at Rhode Island KIDSCount. Well, she will share with you exactly what this progress has been and updates on the anticipated impacts of HR 1. Michaela.
Great, thank you so much. Welcome to our annual celebration of children's health and well-being. My name is Michaela Carroll, and I will be sharing some data and information about the state of child health and well-being in Rhode Island, what we're doing well, what we need to improve, and what we anticipate coming in the years and months ahead. First, we'll start with what health insurance looks like in Rhode Island. Access to health insurance, health care, is a vital support for children's health and well-being. In Rhode Island, the rate of children with health insurance dropped from the COVID-era high of nearly 98% to 96.3% last year. In the same year, 94% of children in the U.S. had health insurance, so we're doing slightly better than the nation as a whole. 3.7% of Rhode Island children were uninsured last year, which ranks us 12th best in the nation, 5th in New England, ahead of me. Another great policy win in terms of insurance coverage is the Cover All Kids Act, which passed in the 2021 legislative session. This restored Rhode Island's policy of allowing all eligible low-income children, regardless of immigration status, to enroll in state-funded right care, and was implemented in July 2022. Covered children can receive preventative care and treatment for childhood illness, but immigration enforcement activities are causing families to be afraid to access the coverage and the services to which they're entitled, despite the fact that they're eligible for this state-funded program. And much of our successes are due to how well Right Care, our Medicaid program that you just heard Paige talk about, works. The reason why we see so many positive health outcomes is because of our high-quality program. For over 30 years, Right Care has been a national model with documented, positive, sustained health outcomes, making it a cost-effective investment in the health of Rhode Island's children and families. The National Committee on Quality Assurance also continues to give Right Care health plans top Medicaid ratings in 2025. Only 14 Medicaid programs in the country received an NCQA rating of 4.5 or higher. The most recent ratings for 2025 give Neighborhood Health Plan of Rhode Island a 4.5, United Healthcare a 4.0, and Tufts Health Plan .32 Health a 3.5. Another win for Rhode Island families is the extension of Right Care and Medicaid postpartum coverage. In 2022, we extended postpartum Medicaid coverage from 60 days to 12 months postpartum, and we allowed state funds to be used to provide coverage regardless of immigration status. This supports maternal and infant health and health equity. Our pregnancy and postpartum program offers coverage for individuals up to 258% of the federal poverty level and up to 141% of the federal poverty level for parents. We also continue to track positive outcomes specific to Right Care. What we routinely find is that Right Care works for pregnant women and people. In 2024, 84% of pregnant women under 21 and 93% of pregnant women 21 and older with Right Care coverage received timely prenatal care, a rate much higher than those who are uninsured. Although a large majority of people on Right Care receive timely prenatal care, there remain large and unacceptable disparities by race and ethnicity. Once kids are enrolled in Right Care, it's critical that they stay covered without unnecessary gaps in coverage. Even a short gap can result in a child missing needed care, like treatment for a chronic condition. For example, if asthma is left untreated, it's likely to result in visits to the emergency room and missed school days. Starting in January 2024, Rhode Island also began 12 months of continuous coverage for children under age 19, meaning they stay covered for 12 months unless they ask to be disenrolled or move to another state. Changes to family income don't trigger a child's disenrollment, so children can maintain coverage throughout the year, even as their family income fluctuates from month to month. So having coverage is important, but continuous and stable coverage benefits them even more, especially young children who have over 14 well-child visits and many illnesses throughout the year. Providing children with continuous coverage also leads to higher coverage rates overall, which are associated with better health, reduced school absenteeism, higher academic achievement for children, and potentially fewer lost work days and lower medical debt for parents. Multi-year continuous coverage promotes health equity by limiting gaps in coverage, particularly for low-income children who experience disproportionate rates of health disparities. Children of color are more likely to lose their Medicaid coverage and then regain it, sometimes more than once. However, the Centers for Medicare and Medicaid Services has indicated that it does not anticipate approving waivers that would permit us to do multi-year continuous coverage. We also know that Right Care works for children. The most recent available data shows that Right Care provides access to health coverage, access to primary care, not just coverage, and is above the national average in these indicators. In 2024, almost 3/4 of children under 15 months, 68% of preschool and early elementary school age children, and 63% of children ages 12 to 17 receive their recommended well-child visits. So let's keep looking at what we're doing well. Rhode Island leads the nation on numerous metrics of child well-being. We rank first in adolescent HPV vaccination rate. We're tied for 6th for the lowest rate of births to teens, tied for 7th for the lowest rate of preterm births, and tied for 8th for the lowest number of child and teen deaths. Now let's look at early intervention. The American Academy of Pediatrics recommends developmental screenings conducted by physicians that refer children with suspected developmental delays to early intervention. Early childhood developmental screenings are important because it helps identify children who may have a delay or a disability. While some children with a developmental delay are eventually diagnosed with a disability, others might catch up to their peers when therapy or intervention is provided. Without screening, developmental problems may arise and worsen over time. 57% of infants and toddlers in early intervention had their services covered by their Medicaid insurance, and 41 had it covered by their private insurance. You can see that the number of babies and toddlers receiving early intervention services dropped during the pandemic, but it's increasing again. In 2024, the number of infants and toddlers receiving EI services was down 13% from before the pandemic, but up 11% from the year before. After 20 years of frozen payment rates, early intervention programs have struggled to attract and retain qualified staff and deliver high-quality services that meet the needs of all young children. This led to children having to wait for services, with a wait list established in November 2021. However, in 2024, the General Assembly passed a budget that included higher Medicaid rates for early intervention, so more providers were able to deliver these services. In January 2025, there were 283 infants and toddlers who had been waiting for EI for more than 45 days. While rates of childhood overweight and obesity remain high, they have started to come back down and are approaching pre-pandemic levels. You can see here the rates of overweight in blue and obesity in orange over time. 27% of children with Medicaid are obese compared to 14% of children with private health insurance. Rhode Island KIDSCount is working with our partners, including Blue Cross and Blue Shield, the Department of Health, and the Brown University School of Public Health, to continue providing a reliable data source for childhood obesity on a state and local level, so we can better monitor childhood obesity rates in Rhode Island and work to address them by looking at the root causes: lack of access to healthy food and safe places to move, play, and exercise. There's more good news to report. More children have access to dental care thanks to Right Smiles, Rhode Island's Medicaid Managed Care Oral Health Program provided by United Healthcare. The number of dentists accepting qualified children on Medicaid increased from 27 before Right Smiles began to 182 1 year into the program, and in 2024, there were 453 unduplicated dentists participating in Right Smiles. That's a lot more. We're also so lucky to have with us here today a mom of 2 kids enrolled in Right Smiles to share with us how the program has been a positive experience for her family's dental care. And another victory to celebrate. Thanks to the advocacy of so many, including Beth Bixby, Margaret Holland McDuff, Representatives Julie Casimiro and Teresa Tanzi, Senators Alana DeMario and Jacob Salian, and Speaker Joe Shikarchi, Rhode Island's mobile response and stabilization services are available to all Rhode Island children, youth, and caregivers, regardless of their insurance coverage. Mobile response and stabilization services provide face-to-face intervention, crisis de-escalation, assessment of needs, and safety planning to families and children in crisis. Providers come to where the child is in crisis and work with them and their caregivers to offer stabilization and support. And we know that these services work. These immediate risk assessments divert children and youth from emergency departments and youth justice system involvement, preventing unnecessary and costly hospitalizations and out-of-home placements. And we're also here today to celebrate improvements to our paid family leave program. There were over 9,300 approved claims for the TCI, or Temporary Caregiver Insurance Program, during 2024. 79% were to bond with a new child, and 21% were to care for a seriously ill family member. 45% of claims to bond with a new baby were filed by men, and 55% were filed by women. And thanks to the tireless advocacy of the Paid Family Leave Coalition, the Right From the Start campaign, Vivian Iyer, Representative Josh Giraldo, and Senate President Valerie Lawson, Rhode Island's Paid Family Leave program's wage replacement rates will be increasing to 70% in 2027 and 75% in 2028. Combined with the increase in weeks passed by the legislature in 2024, more families will be able to afford to take time off to care for their new babies and loved ones. You'll also see on your agenda a QR code, very high-tech. This is one of our new data tools, a data story on paid family leave. Please check that out after our event. While Rhode Island has many successes to celebrate, not everyone has the same opportunities to thrive. Unacceptable gaps in health outcomes by race and ethnicity persist among many measures, including health insurance coverage, delayed prenatal care, low birth rate infants, infant mortality, breastfeeding, childhood overweight, and obesity. For example, only 13% Only 13% of white women have delayed prenatal care compared to 21.7% of black women and 18.6% of Hispanic women. White women and Asian women are more likely to breastfeed their infants than women of other races, and black women have much higher rates of low birth weight infants. These poor health outcomes are shaped by the pervasive racial bias against black women and unequal treatment in the healthcare system, often resulting in inadequate medical treatment and support. Despite our overall progress in children's health outcomes in Rhode Island, we have urgent work to do to close these racial and ethnic disparities in our state. We can also see disparities in economic opportunity and security, as you can see here, and the different rates of children in poverty. In Rhode Island and in the U.S., Native American, Hispanic, and Black children are more likely to live in poverty than white and Asian children. For a family of 4, the federal poverty level is about $31,000 per year. Between 2019 and 2023 in Rhode Island, 29% of Native American children, 25% of Hispanic children, and 24% of Black children in Rhode Island lived in poverty, compared to 7% of Asian and white children. These disparities in child poverty are due to our nation's long history of structural and institutional racism and discriminatory policies in housing, banking, and education. Recognizing these disparities and their root causes is the first step to identifying the policies that we need to dismantle racism and eliminate these disparities. Okay, let's talk about youth mental health. Last year, we released a new publication on supporting the mental health of BIPOC and LGBTQ youth in Rhode Island, which was informed by both quantitative data and the voices and perspectives of youth. As you can see here, we're continuing to deal with the mental health crisis. Rates of sadness and hopelessness among high school students have increased, and were increasing even before the COVID-19 pandemic. In 2023, 36% of Rhode Island high school students reported feeling sad or hopeless for more than 2 weeks in the past year, and almost 10% of Rhode Island high school students reported attempting suicide one or more times in the past year. LGBTQ youth were more likely to feel sad or hopeless, seriously consider, or attempt suicide, along more likely. LGBTQ youth were between 3 and 4 times more likely to attempt suicide than heterosexual or cisgender youth. And finally, let's look at our home visiting program. Family home visiting programs are designed to reach young children and their families at home, providing parenting education to foster healthy, safe, and stimulating environments for young children. In 2024, about half of the almost 2,000 families receiving a First Connections home visit in Rhode Island lived in one of the 4 core cities: Central Falls, Pawtucket, Providence, and Woonsocket. Early Head Start is also recognized as an evidence-based family home visiting program, serving about 300 children in Rhode Island. Unfortunately, enrollment in our family home visiting programs has declined significantly over the last several years due to staffing and financing problems. So, what's next? With the passage of H.R. 1, also called the One Big Beautiful Bill, the federal government enacted major cuts to social service programs, including Medicaid and SNAP. These changes will make it harder for children and families to meet their basic needs, including food and health care. So what does this mean for health insurance? All adults in the expansion population of Medicaid, which includes parents and caregivers, will be required to recertify their eligibility every 6 months beginning in December 2026. Right now, these folks only have to recertify once per year. What this means is it's one more checkpoint every year when parents and caregivers have to fill out complicated forms, and one more obstacle that can mean they lose their health insurance coverage, even if they remain eligible. We know that when parents are insured, their children are more likely to be insured, even if the children are eligible for insurance either way. Up to 70,000 adults, including parents and caregivers, parents and caregivers of children 14 and older, will be required to report at least 80 hours per month of work in order to qualify for Medicaid. And the challenge here is not the work, it's the reporting, another hurdle and another form to submit. Up to 12,000 adults, including parents, will lose their Medicaid eligibility due to their immigration status. Legally present refugees, humanitarian immigrants seeking asylum, certain abused spouses and children, and trafficking victims will no longer be eligible for Medicaid with the Children's Health Insurance Program. And I'm sure you're aware that health insurance premiums have gone up because of the elimination of the federal premium tax credit. The premium tax credit is a federal refundable tax credit designed to help people to help eligible individuals and families with low to moderate income afford health insurance purchased through a health insurance marketplace established by the ACA. Premiums for Health Source Rhode Island, our state marketplace, have gone up 101% on average. Health Source RI indicates that over 13,000 current employees will drop their coverage with the expiration of these tax credits. Right now, there's no solution in sight. While we were ranked second in 2022, you heard me say that we dropped to 12th best in the country for the rate of children's health insurance coverage last year. About half of the uninsured children in Rhode Island were eligible for right care but not enrolled. Of the remaining half who were not eligible based on their family's income, about half of them could have been eligible for financial assistance through Health Source RI. At the beginning of the pandemic, federal regulations required that states keep people continuously enrolled in Medicaid without having to submit additional paperwork until the COVID-19 public health emergency ended. As a result, right care enrollment decreased, and children and families with right care maintained their health insurance coverage until the Medicaid unwinding or the return to normal operations began. Rhode Island did relatively well in making sure that children who are eligible kept their coverage, renewing a lot of people without requiring them to submit any additional paperwork. Rhode Island had 117,890 children enrolled in right care last year, and 2,250 children enrolled in private coverage through Health Source RI. 1,086 kids were enrolled in Right Share, our premium assistance program that helps families pay for employers' health insurance plans. Now let's look at food access while we all enjoy our lunches. We just saw how families receiving SNAP were used as a marketing tool in the government shutdown. Rhode Island children and families were left scrambling with confusing messages coming from Washington, D.C., and our state leaders tried to support families in the ways that they could. H.R. 1 made significant changes to the SNAP program while decreasing taxes for the country's wealthiest individuals and corporations. Provisions of this bill increase the number of parents who must comply with work reporting requirements, meaning they need to prove that they're working enough hours to qualify for nutritional support. This is an additional burden, again, that will make it more difficult for parents, many of whom are already working to feed their families. Prior to H.R. 1, legal permanent residents, green card holders, and certain other documented immigrants were eligible for SNAP. But now, refugees, asylum seekers, and survivors of domestic abuse and trafficking are no longer eligible to receive SNAP benefits unless their immigration status changes to that legal permanent resident or green card holder status. And that can be a long, difficult, and expensive process. This will affect approximately 2,300 Rhode Islanders. The process for updating the benefit amount, the amount of money that families get to help them meet their nutritional needs, has also changed. The new restrictions on benefits updates mean the money that families receive will no longer be able to reflect the actual cost of food or any updated dietary guidelines. Changes to SNAP can also affect automatic eligibility for WIC and for school meals, meaning the children who are affected by one of these changes are more likely to be affected by others. Okay, so some more detail about the SNAP program in Rhode Island. Of the nearly 145,000 Rhode Islanders enrolled in SNAP in 2024, about 70% were adults and 30% were children. Beginning in summer 2024, each child in Rhode Island who was eligible for free or reduced price school meals received $40 per month on an EBT card during the summer months to help make up for the meals that they would be receiving at school. And SNAP is one of the most effective programs to lift families out of deep poverty, also serving as an effective economic stimulus as it moves money directly into the local economy while supporting children and families. Finally, participation in SNAP in early childhood is associated with improvements in short and long-term health outcomes, improved high school graduation rates, and increases in adult earnings. And now, I'm going to leave you in the capable and confident hands of our Executive Director, Paige Parks, who will tell you what we're going to do about all this, how we're working to support Rhode Island children and families, to make sure they have what they need not only to survive, but to thrive.
So much, Michaela. So we have our work cut out for us to keep up the good progress, and I hope that you all will join us in the priorities that we have set forth for the 2026 legislative session. So in the face of current threats, our number one priority is to defend and protect access to basic needs, including access to food, health and mental health services, healthcare, housing, and vaccines for all babies, children, and youth, regardless of their income, immigration status, or gender identity. So if anything, if our kids are going to be threatened, you know Rhode Island KIDSCount will be there. While defending and protecting Rhode Island's progress, we will continue to be bold in leading campaigns for policies that increase equity and reduce disparities in child well-being. These campaigns will focus on civic engagement and working to get the voting right for the student member of the Board of Education. Child development with our partners in the Right from the Start campaign, strengthening access to family home visiting, and ensuring access to early intervention. For early care and education, investing in Rhode Island Pre-K and Head Start with a 30% set aside for infants and toddlers. And increase access to affordable, high-quality child care. For healthcare access, we'll be working for pediatric primary care Medicaid rate increases, and for mental health, increasing access to school social workers, and to sustain and permanently fund the PDPRN program. Out-of-school time learning, working with the Rhode Island After School Network to increase funding for out-of-school time programs, and with our partners at the Raising Rhode Island Coalition to increase the child support pass-through for Rhode Island Works, eliminating the automatic reduction in the Rhode Island Works monthly benefit amount for housing subsidies, increasing the Rhode Island Works monthly benefit to include a cost of living adjustment, and restoring eligibility to green card holders. For family economic security, working with the Right from the Start campaign to increase the state earned income tax credits and to establish a state child tax credit. And to also raise revenue to fund much-needed investments in healthcare, childcare, and education systems. And for youth justice, we have got to establish a minimum age of incarceration and increase the use of juvenile hearing boards. I hope that you will join us in advocating for these budgetary and legislative priorities. And one of the best ways for us to learn about right care is to hear from the parents who have right care coverage for their children. Always a highlight of this luncheon is to hear from our parents. So I am so very pleased to introduce Amanda Havey, and she will speak with us about how important Bright Smiles dental coverage has been to her and her children. Amanda.
Hi, good afternoon, everyone. My name is Amanda. I'm from France, and I'm a mother of two beautiful children. You know, before Bright Smile stepped in, my kids were going to a dentist where nothing felt right. The office was always overbooked. Appointments were hard to get. My kids just didn't feel comfortable at all. My son needed a root canal, and that took 4 appointments. And one of the temporary fillings that was put in actually fell out. I didn't feel confident in the care that he was getting, and when I asked if another provider could handle the crown, I was told no. I felt stuck and frustrated. While I was trying to figure out what to do next, I got a call from someone named Catherine asking questions about my insurance, and honestly, I thought it was all a scam. She asked me questions, and I just didn't think anything of it. But then I later called Bright Smiles for help finding a new dentist, and they told me that they actually had a note that Catherine had reached out. So that scam call wasn't actually a scam at all. It was someone genuinely trying to help me and my family. So from there, everything changed. Catherine found us a new dentist in a very short amount of time. It was just a few days. The office was close to home and it felt warm, very family-oriented. They finished my son's crown right away and welcomed my daughter in as a new patient. But Catherine didn't stop there. She checked in to make sure our information was updated. She mailed new insurance cards, sent out reminders, follow-up appointments, and even made sure that everything was covered and the whole process was simple and stress-free. In my family, I'm the person that everybody calls for help. I'm the one who solves everyone's problems and figures things out, but when it comes to my kids' dental care, Catherine is the person that I call for help, and that absolutely says a lot. Now we love our dentists, they're never overbooked, they've never rescheduled us, and they've always run on time. My kids feel comfortable and truly cared for. Bright Smiles didn't just connect us to dental care, it made us feel supported, and that support made all the difference.
And your children can get access to great high-quality dental care. Thank you. So next we're going to transition to our federal and state perspectives, and you all know me pretty well. You know I like to give our elected officials homework assignments. So I've given them this assignment. We're asking every one of our elected officials to please provide a 1 to 2 minute reflection on why the work they've done for children's health and well-being, why is it important to them, and what can we all do? What can attendees do here to defend the progress Rhode Island has made? So I'd first like to invite Lieutenant Governor Sabina Matos to share her reflections.
Thank you. I promise to stay within your 1 to 2 minutes. Good afternoon. My pleasure to be here with all of you. Thank you. And I want to congratulate the awardees. I saw the list and all of you well deserve to be recognized. And thank you for the work that you have been doing for our children. When I look at the work that I'm doing right now and how, especially with the presentation that we heard, is the access to food. It's something that I've been working on for quite some time to ensure that we eliminate the food deserts and to make sure that there's not communities, especially those that have been, that have the majority of people of colors, tends to have the less access to fresh food. So you have my commitment to work with you, with all of you, to ensure that every one of our kids gets access to the fresh food that they deserve, and work with you in the, especially when we saw what happened right now with the SNAP benefits being cut off and how that affected our community. That's going to be the highlight of the work that we're going to be doing together, but I saw all of your priorities and it's all in line with the work that we have been doing in the office, and I'm looking forward to continue that partnership. The partnership that you have been having with all of us to ensure that our children's voice is respected. And to remind all of us elected officials that we don't have to shoot into the budget and our children. That investing in our children, that's the budget. So thank you so much.
Thank you, Lieutenant Governor. So before introducing our federal delegation, please join me first in sharing our deep appreciation to our federal delegation who held on so strong for what is right for children and families. Thank you for your efforts. First, I'd like to invite up U.S. Senator Jack Reed for his reflections.
I will try to abide by the 2-minute rule, but as a senator, the filibuster must be defended, particularly against the Trump and protest. So, there we go. Let me dispense with recognizing all my colleagues. Thank you very much. I do want to recognize, though, Amanda Hahn. Thank you very much, Amanda. Let's cut to the chase. Rhode Island has led the way because of all of you in child care and everything, nutrition, health care, etc. But we have so much to lose if the Trump cuts and the big ugly bill goes through. And this bill is not only bad policy, it is deliberately mean and petty. And you can see that, frankly, when at one time the president was cutting off SNAP a few weeks ago to children while he's dining with billionaires in Mar-a-Lago. That is insult to injury. In fact, many times I'm tempted to revert back to the vocabulary I learned as a company commander in the 82nd Airborne Division. We dispense with all pronunciation, every sentence ended with an expletive. It's a joke. Can't do that here. Let me get to the heart of it. Republican legislation will cut $1 trillion from Medicaid and nearly $200 billion from SNAP. More than 30,000 Rhode Islanders will lose coverage because of the Medicaid cuts. Another 13,000 Rhode Islanders could lose insurance coverage this year alone because the Republicans refused to pass the tax credit to the Affordable Care Act. And kids will be affected by all of these. Kids are more likely to get insured if the parents are insured. And with respect to Medicaid, nearly half of Medicaid enrollees are children. It is impossible to have cuts of this magnitude without impacting the children served by the Medicaid program. And I would further say our entire health system is in jeopardy if these cuts go through. Everyone will feel it. On top of that, Trump is taking out key agencies like the CDC lead poisoning program. Taking lots of special education and moving to some place where it won't be useful or effective. And it continues its assault on public education. We've got our work cut out for us. And we won't stop fighting these cuts. We'll do everything we can. I know Dave and Seth and Sheldon and I are committed to fighting good fights for as long as we can. But finally, I want to thank you because you are the people that are the advocates, you are the people that will make it work, you are the people that will inspire us to do more. So, thank you, thank you, thank you.
Yes, we are the people. So I'd like to welcome up U.S. Representative Seth Magaziner for your reflections.
Good afternoon, everyone. Thank you to the incredible Paige Parks and the entire KIDSCount team, my colleagues in government who are here, but all of you. We had an announcement a couple weeks ago that a tremendous champion for children, our former Speaker Nancy Pelosi, is going to be retiring, and it made me think about when I was first elected to represent the 2nd District in Congress, and we went down and we had our orientation. The very first piece of advice the Speaker gave to all of us new members. She said, politics can be tough. You have to be prepared to throw a punch. You have to be prepared to take a punch for the children. And in that spirit, it is wonderful to be here with so many fighters for children who not only fight, but win again and again and again. So thank you to all of you for that. When I think about what we have ahead of us, there's two things, and we need your help with both. Number one, as Senator Reid said, we need to continue fighting against these devastating cuts. The cuts to SNAP, the cuts to Medicaid, the cuts to the Affordable Care Act cannot be allowed to stand. And so for the children, we have to continue to fight back. And the best way we can fight back, and the ask that I have of all of you, is by sharing stories. Because data and facts are nice, but when I can tell my colleagues in Washington about the family of 4 in Cranston that is going to have to go without health insurance because they've lost their ACA tax credits, that is a specific story. When I can tell the story about the child who is going to have to go hungry because her family is no longer going to be eligible for SNAP benefits, that is a story. So please continue to do what Amanda has had the courage to do and tell us all your stories so that we can influence public opinion and influence our colleagues to act. Number two, it is not enough to be on defense. It is not enough to just be fighting back against the bad things that they are trying to do. And so our Democratic leader in the House, Hakeem Jeffries, is in the process of organizing working groups to come out with a positive, proactive platform that we are all going to be running on. And we have to make sure that children are at the center of that, that it includes universal pre-K, that includes support for childcare, for paid leave, for universal school lunch, for the other things that we know work, for addressing the mental health crisis and the way that the tech companies are profiting by addicting kids to streaming videos, all of that. Give us your ideas so that we can not just be in a defensive posture, but be on offense, doing things that we know are going to help children. It's going to be a fight, but it's great to be in a room full of fighters like all of you. So thank you all.
And I feel like I'm a non-violent person, but I'm never a punch. I like it. Next, I'd like to invite up U.S. Representative Dee Palma for his reflection.
Thank you, and be assured that this isn't because of throwing any punches. And some old injury. But I'm grateful to be here, and it's always inspiring to be at a KIDSCount function because I leave with more data, I leave more informed, but I also see the purpose that people have. I see the progress that we've made, but I also see power. And that power is reflected in this room through the advocacy, the leadership of so many people. So I'm humbly in front of you. And to the query that we were offered, look, my why is frankly as simple as many of the people in this room. It's because you know all those lives who are impacted. You know the people who are affected. You see, not just in your professional capacity, but as Rhode Islanders in this tight-knit community in which we exist, that these aren't just numbers. They're a bunch of names, they're real stories. And in so many ways, as Seth just described, your stories are the kindling for our work. We can't do anything in Washington without you. It becomes academic without the lived experiences that we have here. So I would expound on what you can do by adding on to both my colleagues in Congress by saying we need to spend as much time with you as possible. So I am frequently out in the community. And sort of every day, my day is trying to figure out how many people I can spend time with in person to capture those stories, not just in written form, but directly. And so I think back to the height of the government shutdown and the inspiration I received at Children's Friend to put forward legislation to stop WIC from being harmed amidst a government shutdown. That wasn't something that came up abstractly. It came from seeing how that essential nutrition program and its disruption would mean the progress that KIDSCount and so many organizations have fought for could be unwound. And so my ask to help ensure your voices are projected, or make sure that we are spending time with you in person. That we are seeing the folks that you serve, that you know that we are doing this work for. So I'm grateful to be in this work with some great colleagues in Washington and with all of you, because we have a lot to do together. Thank you.
That's a very concrete, just making sure that you are invited to things. And Brian Stevenson calls that being in close proximity, right? You have to be in close proximity with those who are most affected. And that's how you can understand and know where to fight and what the fight is. So thank you. Now I'd like to welcome Representative Julie Casimiro, who is not only an awardee today, but she's Deputy Majority Leader and will be speaking on behalf of Speaker Sakarji, and providing some remarks and reflections from the House.
Thank you all very much for being here today and for having me here today as well. On behalf of Speaker Sakarji and the entire House of Representatives, I'd like to thank KIDSCount for being tremendous partners in ensuring our state's youth are cared for, supported, and protected. Believe me when I tell you, we use the data in driving our decisions at the State House and crafting our bills. We are all aware of how today's children are struggling, particularly with mental health issues. Kids today live in a far different world than we did, with endless amounts of information and technology that sometimes cause considerable harm and trauma to their developing young minds. This is why I introduced the Children's Mobile Response and Stabilization Services Act, to ensure that every child in crisis gets the help they need, regardless of insurance status, and immediately without any bureaucratic delays. I personally have referred my constituents to this service because they share their stories. So the stories and the data are very important. I am grateful that Speaker Sakachi and the General Assembly recognize the need and value of this important program to include it in the state's budget. Because if we cannot help our children in crisis, then something is very, very wrong with state government. Rhode Island's future success is directly tied to the health and well-being of our children today. And if we fail to support them, the current generation of youth, if we fail to support the current generation, future generations will be in peril. This is why all of you are so important, because of your help, your dedication, your advocacy, and your compassion. So that's my big ask, is to continue your efforts in advocating on behalf of our young people and our families. I stumbled over a quote I'd like to leave you with today, a quote by JFK that I thought would be really appropriate for today's event, and it is, "Children are the world's most valuable resource and its best hope for the future." So I encourage all to think about that today, and as you go through your advocacy work and your stories, let's continue to fight hard for kids. So thank you.
Casimiro. And now I'd like to welcome Rhode Island Senate Whip David Decoyan, who will be speaking on behalf of the Rhode Island Senate. We'd love to hear your reflections.
Thank you, Paige. I'm pleased to be here to bring greetings on behalf of the Rhode Island Senate, and we're so grateful to the dedication of the advocates of KIDSCount and the outstanding work you do to support Rhode Island children and families. Thank you, Paige, and the entire KIDSCount team for your innovation and invitation to be here today. I was particularly interested when I saw the legislative priorities of KIDSCount and to hear about the legislative action with youth justice, and I was particularly proud to sponsor a bill that established the juvenile hearing board in my hometown in Senate District 22. Now is the portion of the remarks I have to acknowledge all the elected officials. Well, Paige, you did a great job with all of that. Senator Reid dispensed with it, so I'm going to follow suit to move this program and stay within the 2 minutes. So I want to thank you all for your dedication and partnership. And I'm proud to be here representing the Senate and Senate President Lawson, and want to express her deep appreciation for today's recognition for her work with a paid family leave. She has been a champion on this issue because she knows how important it is for Rhode Islanders. The Senate President also asked me to acknowledge the many partners who work tirelessly to strengthen the TCI program alongside her, including State Representative Joshua Giraldo, Divya Nair and the Economic Progress Institute, Right from the Start campaign, and the Paid Family Leave Coalition. President Lawson is humbled to be recognized alongside all of you. It's also my great privilege to recognize the colleagues from the legislature who are also being honored today for their work to support the mobile response and stabilization services. Speaker Sakachi, Senator Jacob Basilian, Senator Alana DiMario, who, by the way, also co-chairs the Joint Legislative Commission on Child Care. I attended one meeting, and she always is extending an invitation for me to go back. So thank you, Senator DiMario, Rep. Tanzi, my good friend, Representative Julie Casimiro, Beth Bixby from Tide Family Services and Margaret Holland McDuff. Congratulations to all of you on this well-deserved recognition, and thank you for your leadership. I also saw several of my colleagues here, Senator Burke, Valverde, and Barnes. Thank you for taking time out of your schedules to be here today. And I wish all of you a very happy Thanksgiving, and the Senate looks forward to working together again in 2026. Thank you.
Thank you so much for Michaela. Thank you. So on to our awards. The Children's Champion Award honors policymakers, community leaders, and partners who have made outstanding contributions to ensure that children have health coverage and health care, including mental health supports, or they're working to address the social drivers of health, like access to housing, economic stability, and community safety. Because these are the elements for our children and families that make healthy communities and kids. Divya Nair. She is the Senior Policy Analyst for Children and Families at the Economic Progress Institute. Divya leads many important campaigns and is a strong coalition partner for the Right from the Start campaign. She is a quiet leader with impressive brilliance. Divya uses her talents to lead the coalition to obtain multiple years of improvements to Rhode Island's paid family leave program. Divya, we are honored to present to you the Right from the Start campaign and the Rhode Island Paid Leave Coalition this Children's Champion Award in recognition of your powerful advocacy to improve Rhode Island's paid family leave program so more parents can spend time caring for their babies or family members who need their care and support.
I'm going to take a page from my executive director, Michaela, and try to start a chant. So when I say when we fight, you guys say we win. When we fight, we win. When we fight, we win. When we fight, we win. All right, great. So Rhode Island passed TCI in 2013, providing time to care for many Rhode Islanders for their loved ones for hundreds of thousands, of Rhode Islanders, and in typical Rhode Island fashion, after we passed the bill, we worked to improve it for another decade. And so in the 2025 session, like Michaela mentioned, we were able to increase TCI's wage reimbursement for the first time ever. And that is critical to making sure that this program is equitable and accessible to all Rhode Islanders. And so the Paid Family Leave Coalition is made up of the AARP, the Women's Fund of Rhode Island, the Latino Policy Institute, the Rhode Island Black Business Association, Rhode Island KIDSCount Right from the Start, the Coalition Against Domestic Violence, SEIU 1199, New England, AFL-CIO, the Planned Parenthood of Southern New England, Rhode Island Parent Information Network, and Rhode Island Women's Bar Association. I might be missing a few, but it's a broad coalition made up of a lot of different stakeholders. And my personal goal with this work is to make Rhode Island's paid family leave program the best in the country. And thank you for this recognition, and I hope you'll join us in that fight. Thank you.
Thank you, Divya. Last year, we gave an honorable mention to Representative Josh Giraldo of Central Falls for his early leadership and continued championing of Medicaid rate increases for early intervention. This year, we are so excited to provide and to present the Children's Champion Award for his leadership in passing the improvements to paid family leave. You have been a steadfast champion for so many issues, and we're so pleased to honor you today with this Children's Champion Award.
We're gonna do a picture first.
Good afternoon, everyone. I am so thankful for being recognized today as a Children's Champion. It's an incredible honor. I'm receiving it from Rhode Island KIDSCount, an organization that has shaped nearly every major policy win for children in our state. Makes it even more meaningful. Also, before I get into all of my remarks, I want to give a quick shout out to my wife, Michaela, who came here from school, raced over after class. I really appreciate it. Also appreciate you, Deja, for coming through. Sarah Anderson, my boss over at the wonderful Blackstone Valley Prep, is here. And to all my wonderful colleagues in government, really appreciate you spending this time. KIDSCount is truly one of a kind. Their data, their advocacy, their persistent focus on equity force all of us, lawmakers, agencies, partners, to confront both our progress and the gaps that still remain in our state. Without their work, Rhode Island would not be the national leader it is today in areas like children's health coverage and early learning access. And without their voice, too many kids, especially in places like Central Falls, that I represent, would be struggling to be seen in policy making. So Paige, Michaela, the entire KIDSCount team, thank you for being the conscience of our state. I'm also honored to be recognized alongside the many other awardees. Hey, Mayor. To my homegirl, Divya, who has helped keep me on track throughout this fight. Quick story, Divya and I were communicating. I went one day without responding, and she made sure that she scheduled a follow-up meeting here before I got up here to speak. Thank you for keeping me on track. Really appreciate it. Congratulations to right from the start, the Pay Leave Coalition, the relentless advocacy from the Senate, President Lawson, and all of the advocates who refuse to let paid family leave fall behind. Congratulations to you all. Also to the leaders moving the mobile response and stabilization services forward. Beth, Margaret, Representative Casimiro, Tansy, Senators Demario, Vasilian, and to the fearless leader on the House side, Representative Speaker Shikarchi. Thank you for building a system where families don't have to wait during a crisis. For me, this award reflects work that has been years in the making. Strengthening Rhode Island's temporary caregiver insurance, or TCI, one of our state's most important tools for supporting children and families. As many of you know, I've sponsored legislation to expand and strengthen TCI because I've seen firsthand how much families rely on it. In 2024, we successfully extended paid leave from 6 weeks to 8 weeks, a really meaningful step that gave new parents and caregivers more time when it matters most. And that foundation, that built the foundation for the larger expansion that we're going to push forward now, with increasing wage replacement to a path towards 12 full weeks of paid leave. Look at me here. These changes are the changes that are rooted in the lived realities of working families in Rhode Island. Nearly half of Rhode Island families with children live with income insecurity. Half. And more than a third of babies are born to parents with no paid leave beyond TCI. For many, TCI is their only option, their only hope. And so thank you for understanding how critical it is, and for your support in increasing the wage replacement rate and the taxable wage rate. It's critical because we know from decades of research that when parents even have a few additional weeks at home, rates of infant hospitalization drop, maternal mental health improves, and long-term school readiness increases. The data also shows that when families can afford to take a leave without losing their paycheck, children, especially children of color and children in low-income communities, get a healthier, more stable start to life. Many of you in this room have heard me talk about my family. My wife, Michaela, and I have 3 beautiful daughters. And when I think back to my middle daughter's birth, she was born prematurely, 11 weeks premature. And those moments that I spent in the NICU, I can't help but think about every parent across the state of Rhode Island facing the same fear without the resources or financial cushion to stay with their newborn in those times of need. No parent should ever have to choose between their paycheck and their child. Strengthening TCI is about removing that horrible choice altogether. As you heard, Rhode Island was the first state in the nation to pass paid family leave, but for too long we've lagged behind since then. Today, thanks to the advocacy represented in this room, we are catching up and once again positioning Rhode Island as a leader. This is how we build a state that honors families. And this is how we honor our children. And this is the kind of work that KIDSCount makes possible by bringing us the data, the urgency, and the humanity needed to get these policies right. So thank you, KIDSCount, for this honor and for everything you do to make Rhode Island a place where every child has a fighting chance to grow and to thrive and to belong. And thank you to my fellow honorees. You all inspire me, and I'm proud to be recognized beside you. Thank you all.
That's beautiful. Thank you, Dr. Aldo. Senate President Lawson is not able to be here today, but thank you, Senator Coy, for bringing in her remarks as well. I know she was really honored to receive this award, and I'll be very happy to give that to her when she is back in town. And as you mentioned earlier, Michaela had mentioned the QR code on your agenda. That is the data story. That shares the narrative, the context, the history of the Rhode Island Paid Leave Program. So it's a new data product from Rhode Island KIDSCount. So I encourage you to take a look at it. It also gives you some ideas of how you can help us continue that progress that Divya is already working so hard on for next session. So now I'm going to bring our attention to our next awardees. Beth Bixby and Margaret Holland McDuff. Beth is the CEO of TIDES Family Service. Since 1993, TIDES has promoted family preservation and maintenance of youth within their communities. And Family Service of Rhode Island, which Margaret Holland McDuff is the CEO, works to advance opportunity and hope in our communities and believe all children and families have limitless potential. These two women are social workers, so I learned don't mess with a social worker, don't get in their way. They have worked tirelessly to ensure that mobile response stabilization service was first a piloted program and is now a permanent program. MRSS is a crisis intervention tailored for children and youth and their families, designed to deliver immediate, in-person support to children and youth experiencing behavioral or emotional crisis. If a child is in crisis, MRSS gets to that child within 45 minutes wherever they are. It's been a game changer for the mental health crisis, and I am so honored to present this Children's Champion Award in recognition of your powerful advocacy to ensure that MRSS services are available to children and youth across the state, regardless of their insurance status, to address the urgent mental health issues of our children.
Thank you, Paige, and I know we're at the end of the ceremony, so I will keep it short to the 2 minutes. I do want to thank everyone who's here, especially KIDSCount, the congressional delegation, the executive branch, leadership in state government, and our community partners. It is truly humbling and an honor to stand up here with my friend and colleague, Margaret Holland McDuff, as we see this recognition together. Today we not just celebrate a program, but we are celebrating a promise of trust between agencies, communities, and most importantly, families in Rhode Island. And I can say Mayor Rivera's office has called me directly to make referrals, as well as Rep. Casimiro has said. So it is a true partnership of the community. MRSS has worked, I feel, because families have trusted us in a moment of crisis, when they're at their worst, and it takes a lot of courage to pick up that phone. Our agencies have worked together and not just shown up as professionals, but as partners. We built trust day to day in homes, schools, and in neighborhoods, and that's allowed us to deepen these relationships. This matters because when a family is in an emergency, bureaucracy, what kind of socioeconomic status you are from, or what kind of health insurance you have should not matter. But what does matter is a person who's at your door, in your house, to say, I'm going to be by your side while we're working through this crisis, and then deliver and ensure that you're not sitting on a wait list after the fact. Tides began this journey of mobile response at the height of the pandemic in September of 2020, and I do like to remind people, not many people were out in the community during that time, and that was a huge risk for us when we did that. And I have to say, my staff, I do thank them because no one else was out there, and we were out there responding to this crisis. So as you heard, we are in-person, in-home, community-based response, and the mission is really simple. You meet families where they're at, and the commitment extends beyond the single visit. And that's rooted in the mission. For anyone who knew the founder of Tides Family Services, if you think I'm relentless, he was way worse than I am. And our tagline is, we never give up, never, and whatever it takes. To our fellow awardees who are true champions, I do want to thank everyone. I do want to give a shout out to Elizabeth Burke-Bryant, who has walked by our side as well, as all the KIDSCount staff and other people in state government. As the future of MRSS is considered, my hope is that it will continue to remain supported as it is now. It is strong and not only improves lives, but it will strengthen the system and the economic development of our state long term. So now it is my privilege to introduce Margaret Holland-McDuff, the CEO at Tides Family Services, and because this is a KIDSCount event, she is going to share some of the data. Thank you, Margaret.
Thank you so much, and I really share and appreciate everything that you said. And I'm just going to start about the trust journey as well. Trust has been a foundation of Rhode Island's MRSS journey. When FSRI established MRSS teams, we knew from our long history of community-based care that entering a family's home during a time of crisis is a profound privilege that comes with immense responsibility. We approach every response with respect, compassion, integrity to earn each family's trust. Community trust is never given, it is earned. One family, one teacher, one child at a time over decades of commitment to Rhode Island communities. This trust cannot be built with system design exercises, flow charts, or grant proposals. Showing up when you say you will, in communities every day and night, standing with partners, standing with families, never giving up on them, like Brother Michael told us, responding with respect and kindness, and leading with ethics and transparency. This is what builds trust, and this is what makes this partnership so impactful. The results reflect that promise. Tides and FSRI have served thousands of families, and over 90% of the youth served by MRSS have avoided psychiatric hospitalization and ER visits across Rhode Island. MRSS has avoided police involvement in over 98% of responses, making it a powerful tool to prevent and divert youth from the juvenile justice system. Together, Tides and FSRI have developed a unique system of coordinated care, creating one of the strongest mutual aid mobile mental health crisis response systems in the nation. These achievements are possible because families, schools, pediatricians, parents, mayors, communities trust us. I must thank Beth for being a colleague and a friend that I can always rely on and I deeply trust. This initiative has been a labor of love for both of us, as you can hear, and I can't imagine who else to work day and night and day, as her teams well know, to make this happen. We would also like to thank all the state leaders of EOHHS, DCYF, and BHDDH, and the legislature, especially those who are being honored here today, who are really MRSS champions, and also including the Senate President Val Lawson. We never forget that public dollars are entrusted to us and come from taxpayers, and we hold ourselves in the highest standards to deliver on that trust. Your investments in MRSS have saved lives and preserve families. And I also want to give a special shout out to Elizabeth Burke Bryant, who has been our partner, working side by side, sitting at the State House many late nights to make this happen. While we can have a vision, and some of our legislators here know today, that Beth and I can advocate, along with Elizabeth, the true heroes of MRSS are our team members that transform lives 24/7, 365. So we accept these awards on behalf of the heroes of the MRSS teams of TIDES and FSRI. So thank you, Paige and KIDSCount, and to all those who have supported this work for this honor. This award is not the conclusion, but is a reminder of what is possible when we work together. And as you can imagine, there is more to come from this partnership until every child is safe and every family is supported. Congratulations to all honorees, and thank you.
Thank you so much, Margaret and Beth, and thank you all for hanging in. I know we're getting close to the end, but we have 5 General Assembly members that we really want to acknowledge and thank, because 5 of them, because it takes a really well-coordinated team to address the youth mental health crisis. And I will invite up first our representatives who are being awarded, Representative Tansey and Representative Casimiro, for their leadership in the passing of MRSS. Because of their efforts, multi-response stabilization services are covered by insurance, converting it from a pilot program to a Medicaid benefit. Their work established a rate methodology for Medicaid benefit, and they got $900,000 of general revenue to support providing this service for children who are underinsured or uninsured.
Well, good afternoon, everyone. When we fight, you win. Okay, when we fight, you win. Well, I want to thank you all. I want to thank KIDSCount for all of your support over the years. Obviously, all of the hard work that you have put into the research and staying late hours at the State House to testify. I don't know if it's a coincidence, but it seems to me like those corporate lobbyists, they're out a lot earlier sometimes. But I don't know, it might just be me, you know? I want to just point out a couple of things. Actually, I want to start by thanking Beth and Margaret as well, because they are the heart and soul and the driving force behind this program. And I have had constituents use this program. So it is with great passion that they brought to this, and support that we couldn't have achieved this without them. So I just want to thank them. And I just want to do a broader picture, right? Because we, at the state level, are facing so much pressure from things that we have no control over, okay? I appreciate all the work that you guys do on the federal level, but we can't continue to rely on the federal government right now. We'll just kind of have to pretend that they don't exist at some point, right? And we're going to have to learn to take care of the people that we represent in our state, the people who are our friends, our neighbors, and we need to step up to the plate to care for them, okay? There's no denying this, right? So a couple of key points that kind of stuck with me about HR 1, and I will only refer to it as HR 1. The top 1% of income earners will receive more, 1% will receive more than the bottom 60% in tax breaks. $117 billion, that's what we're talking about. Those who earn over $500,000 will receive $1.5 trillion in tax breaks under HB1. And under HB1 or HR1, I don't even remember, those same people earning $500,000 or more that are getting that $1.5 trillion in tax breaks are receiving the exact same amount as the benefits that people are losing when we will cut their SNAP, their Medicaid, and their ACA subsidies. So those are the people who are benefiting under this, and we, and the people that we represent, are the ones who are paying for it. We have to get that message out. We have to make sure that people understand that it is a one-for-one trade. Okay? And it's not in the best interest of our state or our neighbors or our friends and our families. And the final piece, HR 1 will block as many as 20 million children from receiving the full $2,500 tax credit. And it's another bill that I've been working on for a couple of years that needs our support, because without that money, or with that money, we knew how many children and families were lifted out of poverty. We knew what a difference it would make. Well, it's being cut back, and fewer people are going to be eligible for it, and we as a state need to stand up and make the difference to support these families out of poverty. So I want to refer to what Senator Reid said in my closing, which was, it's all of you in this room who made everything in the past possible, and we are counting on you more than ever so that our state is the one who can carry these programs forward, can improve upon these programs for the people who most need them. And I just want to say, I know that KIDSCount will be right there with us all the way, and can't thank you enough for the work that you've done. Thank you.
I just want to say thank you. You already heard from me, but I want to say thank you to Margaret and to Beth. It was a pleasure working with them. They kept us on track, and I can assure Brother Michael right now, they never give up. So don't mess with a social worker. Thank you.
Thank you so much. And now I'd like to invite up our friends from the Senate, our Children Champion Award recipients, Senator Alana DeMario and Senator Jacob Basilian, for your leadership in the passage of MRSS.
What is it first?
Thank you, this is great.
Quick picture.
Sure, we're more.
Right.
Oh, yeah, sure. I know Paige said 2 minutes, so I hope to have you all out here by 2 o'clock. No, first and foremost, thank you. I really appreciate not just the recognition that really is owed to all my colleagues in the Senate and the General Assembly. It means a great deal. I saw Leanne on my way in. I saw Kelsey here as well. To the entire staff at KIDSCount, I want to say thank you. You were ever present up at the State House, not just this past session on this one measure, but on, ever since I started working in the State House, which was in 2014. I did have an opportunity to meet one of your board members at my table, and as the CEO of a local nonprofit named Justice Assistance, I know that no executive director does it alone. So from Olga, who's the newest board member that I met, but I also saw Lauren Nocera's on the board, and Jim Vincent and a few others. I just want to say thank you to everyone that volunteers on local boards, because no one does it alone. And in that vein, Senator Burke is here, Senator Vargas is here, Senator Valverde is here, Whip Takoyan, all on behalf of a deeply grateful Senate, and Senate President Lawson, who I know espouses not just the commitment of the chamber, but I saw we reflected on the achievements of what we passed in 2022 relative to 12 months of continuous coverage on postpartum care, and that was an effort of someone who I'm privileged to have in the Rhode Island Senate, Mary Ellen Goodwin. And I know how important that was, so to see how that cascades through time and improves outcomes was great. So I'm here on behalf of the grateful Senate, but also myself, and it's truly a blessing to follow Margaret and Beth, two titans, if you will, of the care economy in Rhode Island because I said something at the Rhode Island Coalition Children and Family event a number of weeks ago. We talked about MRSS, and it was a Frederick Douglass quote, and it said it's easier to raise strong children than repair broken men. And a lot of folks nodded their head and said that, and I walked away, and then I was listening to Beth and Margaret talk, and I think it probably all too briefly encapsulates all the work that goes into that. And so I just want to say thank you for the work that you and your teams do every day to work with parents and families to raise strong children. So thank you very much. I see Chief Judge Fort is here from the Family Court, and I would be remiss if I didn't bring up one of the things that I've always enjoyed about Rhode Island KIDSCount, and that is the snapshot and data that you get every year with a particular focus on juvenile justice reform. And if I may, I like my quotes, but there is one quote when I was reading the most recent report that they did on juvenile justice reform specifically that I think is so important. And it's really a window into why I care about these causes. You've got to keep kids occupied. This comes from a kid. If I was occupied in something, then I wouldn't have did it. If I had only had something to do. I think all too often it's easy to get caught up and really go about your life, particularly if you come from a strong household, as I was fortunate enough to do. And then I went to college, and I was still a young man, and some things happened to me that can happen when you're no longer in a strong household. And it was easy to see how my life took a different turn when I didn't have my parents involved in my life. And so the statistics that are evidenced in this report, and it's done annually, really paint a telling picture, and that is that 70% of the youth arrested annually in the United States have a diagnosable mental health disorder. And so the work that goes into this report, I just like to highlight because it's so instrumental in painting a clear picture for the policymakers up at the State House. And I want to thank you for highlighting the stories of families at this luncheon. That can be so powerful. I was at a Thrive behavioral health event where a similar thing was done. And because those are the stories that hopefully we leave with us today. And I will just say that there are a lot of folks in this room, from agency directors to volunteers on nonprofit boards. And yes, we are facing budget calamity that may be derivative of the stuff down in Washington, or even right here we see shortfalls in our own state. But there are always opportunities to pitch in and be more compassionate and show more empathy at every turn. I was at a meeting as a result of my day job with Rhode Island Traffic Tribunal last week with Chief Judge DeSandro. And one of the biggest barriers that individuals face as they're bumping into the guardrails of the criminal justice system is transportation, not just housing, but transportation. A lot of folks have their licenses suspended or can't get it back because of fees and fines. And I will just say that customer service can make all the difference in an individual's life. There I met with their staff, and they were so proactive in trying to work on driver's license reinstatement. And we actually heard stories from individuals who had their licenses suspended that would tell you stories with tears in their eyes about how powerful it was for them to have that customer service forward approach in getting their driver's license back. And so that's one thing I would just like to leave everyone with as we enter the holiday season, is that you never know where you pitch in or you leave with your best foot forward, how instrumental it can be in changing someone's life or just making it easier for them to go about their day. So with that, I just want to say thank you, Paige. It's Rhode Island's KIDSCount, and everyone have a happy Thanksgiving. Thank you.
Thank you, everybody. If there is one thing that an outpatient mental health counselor knows how to do, it is keep good time, and so I promised that I would do that. Before, though, I was an outpatient mental health counselor 15 years ago or so. I was working in community-based mental health as a clinician in programs that were rooted in the belief that it was essential to keep kids at home, in the community, and in their schools, out of hospital settings, out of the training school if at all possible. And we would do that by being responsive to what families needed and giving them the wraparound types of services that they needed in the places where they were. Now that was 15 years ago. And all of these programs were run with grant dollars as pilot programs. They did great work, but they were not available to everybody and they were not sustained. And fast forward 10 years, I somehow managed to get myself into the Rhode Island Senate. And also there was a pilot program happening with MRSS services that sought to be able to have barrier-free entry to stabilization services for youth in the community. I am so grateful to have the opportunity to work in the Senate to help make sure that this program is not only sustained, but that it also is barrier-free for every single family and youth in Rhode Island, regardless of insurance type, regardless of geography. Because if we are going to be a state that is truly committed to diversion and to keeping kids in the community and giving kids and families what they need, we need to make sure that there is no wrong door into that service, and we need to make sure that nobody is turned away. Finally, what I want to say is that in order to sustain this program and to fulfill our commitment truly to this principle of diversion, MRSS not only needs to be sustained, but it also needs to be situated within a service array of diversion-focused responsive care that fits in with 911 services, with 988 services, and that is backed up by services like BH-Link. Because every Rhode Islander should have the opportunity to have responsive, right-sized care where nobody is turned away and everybody is able to get exactly what they need. I am so grateful to have worked alongside all of the partners in this room to be able to achieve where we've gotten to today. But what I also want to say in conclusion is that I do not accept this award as a symbol of a job well done, but instead as a signal that I'm working in the right direction, and I promise to keep going. So thank you.
And Senator Basilian. Speaker Joseph Karchi is not able to be here today, but we will deliver him his Children's Champion Award for putting $900,000 of general revenue into supporting MRSS. And as you know, getting any money out of Speaker Karchi is very difficult, but he knew that saving a child's life is worth every single penny. So, in conclusion, I want to thank all of you for being here today. I want to thank all of our healthcare providers that are here and are working with kids, our doctors, the Academy of American Pediatrics, Hasbro, Brown University Health, Care New England, Community South County Health, Women and Infants, our CCBHCs, and all of our mental health centers and community agencies and grassroots organizations. Thank you for your work every day. We are having a holiday sale out there. So out there you will see the 2025 Around KIDSCount Book is on sale. It's BOGO. So you can get your early Black Friday sales on right now. So that while supplies last. We have so much to celebrate. I hope you had a good lunch. I hope you're leaving inspired. And we will continue to do more work together to ensure the optimal health and development of Rhode Island's children. Thank you very much, everyone. Happy holidays and take care.